So got it. So good morning, participants. I'm going to introduce Dr. Ray Didi, for friends, to give a talk on decisions in disaster risk. This is a project that started a few years back. How long was it? Like about 4 years, right?
5 years.
5 years.
Right.
And it took a long time to put together. I would say that she's the whole author of this version. Although we did try to write, we are trying to publish the paper in a journal, but nonetheless, Didi is very accomplished. Actually, if you look at her, I think I don't do justice to her by telling you about her because her short bio is excellent. She's a doctor from Drexel University Medical Center. I think I don't know, not showing it right, but doing a study in the Massachusetts Institute of Technology, MIT, and then that was the MIT was actually surgery, right?
Mass General, yeah.
Mass General, right?
Yes.
So actually, you can see it's actually a full-fledged doctor using a. She's very interested in that, and now she works in New York. And one of the, in the previous life before she started dealing with children, she worked on disaster risk, how to measure it. And so the talk today is about exactly that, a model that she developed along with other colleagues. And the interesting thing about this project is that the concept of expert is not the expert you think about in general. That's the part that really interested me the most. So I don't know, without any further ado, I'm going to let Didi take the floor. So please, Didi, take over.
Thank you so much. And I'm really honored and excited to present to you today. I have a lot of material to cover for the hour, so I'm going to go through some of the concepts very quickly. But if you have questions at the end, you can. We'll certainly have time for that. And then, of course, when our paper comes out, I encourage you to take a look there. But today, I'm just going to go over some background and core principles because I know that many of you won't be familiar with with emergency management as a discipline or a doctrine. I'll quickly go over New York City's use case, and then I'll go over the methods of how we use the AHP and how that resulted in really interesting and unique features that that are really novel in this field of disaster risk assessment. And then I'll just conclude by going over, what this new process adds to the field. And this is just a brief introduction, which is the abstract of the presentation. But it really goes over the fact that, that this idea of disaster risk is it's something that is surprisingly very new in this field of disaster management. And as you'll see in the presentation, how we actually define disaster risk, how we use measurements of disaster risk is something that is very, very undefined still in the operational field of emergency management. And as we go into the emergency management doctrine, I want to just start by saying that we are in the middle of what we call the Anthropocene era. And as you can see from the images here, the Anthropocene era is an era where the world around us is largely shaped by human actions and human interventions. And of course, most of these actions, when you get in your car every morning, if you get on a flight, these actions aren't taken with a view of the long consequences or the larger worldwide consequences most of the time. And as a result, we find ourselves in an era of accumulating severity and frequency of disasters. And over here, I just have a snapshot of New York City, which this project was created for. And these are just some of the disasters. Now, I come from a public health emergency management perspective, but these are just some of the public health emergencies that we've responded to. And the different colors represent different types of hazards, but you can see there's a whole gamut here. This is also a selected list because if I put every single emergency response on here, you wouldn't be able to you wouldn't be able to tell them apart. But you can see that we have hurricanes here, and these are once in a century hurricanes. We have disease outbreaks, both of diseases that we knew about that had been previously controlled, like measles, or new diseases like cat flu, which was, one that you may not have heard of, but yes, it was a flu in cats. We just worried about it crossing over to humans. We have, the Ebola outbreak, which many of you are familiar with. Simultaneously, we've got earthquakes in Puerto Rico. I forgot to put Hurricane Maria on here, and we have heat waves, and of course the COVID-19 outbreak. Most recently, we have the monkeypox or mpox outbreak, which I also was one of the leaders in the response. So when we look at the management of these disasters, there's actually a whole field separated into different phases. But of course, the phase that we're focusing on right now is the preparedness cycle. And in the United States, this is preparedness largely falls to governments, though, especially over the last couple of decades, we've seen agency from non-governmental groups, especially the healthcare system and community and volunteer organizations who are, of course, experiencing disaster and therefore, actually end up being what we call the first and last responders to disaster. But everybody kind of goes through what we call this preparedness cycle. So anytime you are not in a disaster, you're supposed to be working through this ongoing preparedness cycle. And what you can see is that threat, hazards, and risks, in addition to preparedness priorities, really undergird this cycle. So a risk assessment or disaster risk assessment is supposed to be the foundation of the cycle where we identify risks, we prioritize different hazards, different aspects, different activities in preparedness, and incorporate them into plans, staff those plans, equip those plans, train for disasters, exercise, and then evaluate. And then, of course, once you've evaluated, that should go back into a new cycle of planning. So, when times that aren't disasters, we usually call blue skies. And blue skies is not supposed to be a period of rest. Blue skies is supposed to be a period of constant preparedness and constant activity to ensure that when a disaster hits, you're actually prepared to respond and the response is effective. So, I'll talk a little bit about those disaster risk assessments, but I hope you see that they are really critical and foundational to really both preparedness and response. So in 2018 in New York City, you saw the whole gamut of disasters that we are facing and that we are trying to prepare to face. But in New York City, in 2018, we really wanted to approach our disaster risk assessment from a systematic way, and really create, a solid methodology for preparedness that's also transparent, that is acceptable to our whole, all of our constituents, which is everybody in New York who could get impacted by a disaster, right? And when we went to look at the existing methods for risk assessments, no consistent method exists. In public health emergency preparedness, risk assessments really only started being used in 2011. And, I'll show you in the next slide some of the more systematic risk assessments, but, most risk assessments, if you look across the country to every county, to every, even to cities, very often what you do is you get a couple of your, long-standing emergency managers, you put them in the back of a smoke-filled room and they come up with a ranked list of hazards. And that's how, that's how all your resources are allocated. That's where your preparedness work is. And when it comes to a response, that's what you're ready for. And, that was really not systematic enough for us, especially when we're talking about spending taxpayer money, when we're talking about the lives of all of our constituent New Yorkers. And so as we looked through different ideas of risk assessments, we came up with a couple different questions. The first thing is you want to define what the elements of risk are. So what do you mean by risk? And then you have questions like what data determine that, right? So how do we know about risk? Where do these data come from? How diverse or comprehensive are they? Then once we have all these pieces of data, how do we aggregate them? And then finally, which is perhaps the most important question, how do we use them? And I won't go through this whole table, But, I mentioned that most risk assessments are just, the perception of a couple of people who've worked in the field for a while, who happen to be employed, by the agency doing the risk assessment. These are a couple systematic assessments. You can see there aren't many of them, but this is really a representational slide of all of the systematic approaches to risk assessment that exist within disaster risk assessment that exist within the field. I'll point out a couple of them, but what you'll notice is that all of them start with a risk equation, right? And really this risk equation incorporates a couple different pieces. It incorporates how bad the disaster is, how likely it is to happen, and very often you have some sort of mitigation or impact element which talks about, what can we do about that disaster and how good are we at it. So I'll mention first the FRAT. Now, most of these, I mentioned that, the sort of standard is really risk perception, because these are high impact, low probability events. They're very complex. There is one method which gained a lot of popularity in 2011, which really only looks at big data sets, and they attempt to make an objective assessment of risk. And we will, we took the different perspective where we really rely very heavily on risk perception. And that's one of the big foundations of this assessment. It's really different from, there are elements that are similar to all risk assessments that are used in the United States, but we really differ from this FRAT assessment in that we say that, this field is something that requires expertise to understand. And that's one of the big driving forces that led us to the AHP. As you look at the other, the other models here, you'll see that, really most of the other ones look at a lot of risk assessments. Some of them look at quantitative and even geographic elements, but all of them try to bring in some element of the community, right? The community that is impacted by disaster. Many of them, try to assign sort of an orphan number, which is, we're going to give you a scale of 1 to 5. The scale doesn't necessarily have units, but that there's no sort of consistency between the scale, and that's something that bothered us in approaching our risk assessments. Data aggregation is usually an arithmetic mean, but there isn't a lot of justification for that arithmetic mean. And then perhaps what's most important is that many of these risk assessments, start with, just say, here's some severity, here's some impact, and they just put a bunch of numbers in front of leadership, right? And then ask leadership to say, look at these numbers, make a decision, make your budget based on your inherent understanding of these numbers that we kind of just made up, right? The best assessments actually plug into, let's say, a mitigation domain or an operational plan. And so that's just some of the background to set up, what we did and why we did it. So now I'll just start going into what we actually did, and I'll start with our risk equation. So our risk equation was defined based on our earlier work and is pretty consistent with the equations of most, with the risk equations that most other jurisdictions use. But we actually started with a model of community resilience after disasters. And so the idea is that you have your planning phase or your blue skies, a hazard event hits, right? And a hazard event can be a hurricane, it can be a flood, it can be anything, but the threat of a hazard is kind of always looming. At some point, an event actually hits, and at that point, that event begins to have consequences. So within a community, you have the ability to absorb and recover from this hit, right? And the hazard event, right? The fact that the likelihood of a hazard event to actually happen is your probability. Your severity is the actual impact, right? That is how far down, what kind of shock you're supposed to absorb. And then that's mitigated by the manageability, which is what you've done either to prevent the event from occurring, or to manage the severity, right? To mitigate the outcome of it. And so our risk equation for a given hazard is the probability times the severity divided by the manageability. It's pretty simple. And so doing that, we decided to apply the AHP to the rest of our model. And so our first step is to decompose this risk equation. So you can see our risk equation here. We've got our hazard risk, we've got our probability, severity, and manageability. And then our first step was to decompose all of these elements and to select a series of alternatives. And since this was the first time we engaged in this process, we actually engaged all of our stakeholders in creating the subcriteria and in creating the lists. So we came up with 9 hazards. We did this through for each of these, in general for the subcriteria, but especially for the hazards, we asked participants to do a long list where they were able to submit their own ideas. We did a qualitative analysis and then came up with essentially 9 themes for the hazards. Then actually we came up with more than 9 themes for the hazards. Then we gave them back to participants to shorten that list to a maximum of 9. And then we had a steering committee involved in all of the pieces, just of a diversity of disaster experts, just to help us, come up with the actual final criteria before we made any judgments. Within each of the subcriteria have special features and were thought out in sort of unique ways that add features to the model. So first we started with probability, and this is one of the really interesting aspects of the model. So, when we came up with probability, our first question was, how are we going to assess probability? And luckily at the health department in New York City, we have entire epidemiology groups dedicated to calculating the probability of certain hazards. And so we found that we couldn't pick one, because for these high impact, low probability events, there isn't really one right one. Every element has, or every, method of assessing the probability starts with, there are methods that are very concrete. And you'll see this actually throughout all risk assessments. There are methods that are very concrete, that are simple to understand, but those are often highest rooted in the past, and they're very brittle. And it's hard to engage with changing environments and changing times, versus you end up with some methods that are, really interpretive, not that quantitative, but really rely a lot on the expertise and the minds of these people who just look at these numbers and look at these probabilities every day. And so what we decided was to use all of them. So we actually made each of these probabilities a subcriterion. And you can see we have at the very, most concrete, we have the number of reported occurrences, right? Just looking into the past. And, of course, that's really great at measuring the past. It has its own biases, et cetera, but it's the most sort of objective of these. At the least objective, we have the changing threat landscape, right? This is an idea where we understand that there is an increased impact of terrorism, of globalism, and of course of climate change on all of these disasters. And while we may not be able to quantify them, we can certainly compare them. We can say that I know that the impact of climate change is going to be very big for hurricanes. And while it will be big for cyber attacks, the impact on hurricanes of this changing threat landscape may be larger. And so what we found actually was that the more, when we took this to a group of probability experts, to make their decisions, to weight the criteria, we found that the more interpretive probability assessment measures were given a higher weight. But by including all of them, we were really able to include like a gamut of different techniques, rather than assigning just sort of one method or one single aspect of probability. For severity, the severity subcriteria also represent, something that is very important with us, which is how we engage our stakeholders. And in public health, when we look at disease, when we look at, the bad outcomes in health, everything starts in what we call the social determinants of health. And so for the severity subcriteria, we really started with the social determinants of health and used our stakeholders to cut this list down to a manageable list of subcriteria. We ended up with 9 subcriteria. After we weighted the subcriteria, we were able to drop 2 because their influence on the overall weight was very low. But the great thing that we ended up with here is after we weighted the subcriteria, when we went in to a community organization, to a healthcare organization to say, this is how we plan to allocate our resources, or we wanted to go, enter into ongoing conversations about the disaster risk of the city, we found that, prior to this model, let's say that an organization working in Hurricane Sandy that dealt with mold damage to houses, right, really felt that when they talked about the severity of a hurricane, they were really concerned about toxic exposures and environmental contamination. And maybe in their heads, that was 90% of the severity decision. Whereas, traditionally in public health, we talk about morbidity and mortality, which is deaths and severe illness and injury. And so very often in all of our community conversations in preparedness, we found that we were speaking different languages than the community. Now, one of the additional features that we didn't actually plan for with the AHP is that by coming up with this weighted list of subcriteria, we ended up with the sort of common set of values of our whole community that we could use to base our discussions on. And so, additionally, in addition to, the stakeholders engaging in this process, this actually pushed forward our engagement in preparedness at all phases outside of the risk assessment. And then finally, our manageability subcriteria. So if you remember, the manageability subcriteria are really the actions we take in disasters. And for this, we had a lot of subcriteria. We had 30 subcriteria, which, as you can imagine, added a lot of complexity to our data collection and analysis. We had to employ a clustering pivot method. This ended up with hundreds and hundreds of comparisons that we had to collect from communities. But the benefit of this was that we were able to map all these subcriteria to an existing comprehensive response inventory. And you'll see this a little bit later when we talk through the synthesis and the application of this. But essentially what we ended up with was, we ended up with ratings and numbers for every one of the activities that we are already ready to do in preparedness, right? And each of these activities has an owner. Each of our exercises, our training, our evaluation, all of our preparedness activities are really built out of combinations of these activities. And so we were able to plug this risk assessment directly into our operations the second it was done. And I mean, I think we finished in, I believe, the end of October, and by mid-November, we were using these data for prioritization processes for the next year. And, this is one of the key, I mentioned this earlier, that very often, you come up with a bunch of numbers don't sort of have any meaning on their own, and you throw them at leadership and ask them to use them. And what you see with a lot of risk assessments is that no matter how complex or how beautifully designed they are, nobody uses them. And so that was something that we were able to avoid, which is probably one of the most, important features, that you actually could use our risk assessment. And so that was quite a bit on decomposition. But then as we go into measurement, I'll just say briefly how we were able to collect all our data. And we actually used a SurveyMonkey platform. Within disasters, you have to pay special attention to individuals with disabilities, and you want to make sure every method you use is accessible to a full population. Because if you're excluding the individuals who need disaster services the most, or are most important to involve in preparedness, you've created a bad scheme. So we actually used SurveyMonkey to elicit our comparisons. And, we basically broke down every comparison into, which of these is more, right? A or B. And the answer was A, B, or they're equal. Then secondarily, we asked how much more likely, and this is how we were able to obtain the relative comparison weight. This is pretty simple. Most survey tools will do this, but one of the unique features of SurveyMonkey is that we were able to create an answer summary at the end of the comparison, where we actually were able to pull in everyone's choices. So for example, if question 1 is, which is more likely based on an increasing frequency of similar events, or I'm sorry, this is a different question. If we wanted to say, which probability method is more important to the judgment of hazards, forecast models versus the increasing number of events historically, we actually have the choice right here. And so at the end of the process, every participant was able to review their answers. And if they wanted to, let's say, revisit question number 3, they could hit question number 3, go directly there, and not have to click through the entire survey. Now, additionally, as I mentioned, this is accessible. So we had several individuals who were blind or low vision, individuals who could only use keyboard access because of a physical disability. And we had several individuals who were able to participate in this survey and complete the survey. Additionally, use of the SurveyMonkey tool, it's not very expensive, but it's also a very easy export for analysis. All of the analysis was done in R by me. This wasn't a very well-resourced project, so all of it was done just by me individually over the period of a couple of months. And the result of this is what Luis mentioned, and which is one of the really critical aspects of this risk assessment, expanding the definition of expertise. Right. So because we use this method, because we used the online data collection method, because we used an accessible format, we were able to get 1,834 total participants from a variety of sectors throughout New York City. And what we did here, and when I give this presentation to community members or to emergency managers, this is one of the biggest points I hit on. I talked about risk assessments being a bunch of, old firefighters in a room, having a short conversation and then spending all of the government's money, right? What we have here is we've said that risk needs to be determined by the experts, but rather than saying the experts have to, have a PhD in the subject or have worked in the field for 20 years, what we're saying is that anybody who has a lived experience of disaster and disaster response is an expert, and we want you to directly participate in the risk decision and in how our government funds, our government resources are going to be allocated. I think this is one of the important pieces of this, is that if you looked at the other risk assessments that look at risk perception, they often have use strategies like, for example, a Delphi method or a facilitated discussion. And the thing is, you first of all can't have 1,800 people in a facilitated discussion without a massive amount of effort. But one of the things that we really see when we try to have these conversations is that you'll take a community-based organization that has all this wealth of experience, but they can't, you can't get them in a room with a very loud, let's say loud governmental official. For me, I talk a lot. I work on this every day. I study it, and I can be very loud about it. And I can use a lot of terminology that isn't understood by community organizations, by volunteer organizations that often even have better direct experience than I do. And this way we were allowed to distill all of those kinds of expertise and integrate them, which is something that no other risk assessment method out there offers. Finally, if you get to synthesis, these are the results of our risk assessment. In the end, you'll see we come up with a nicely neat ranked list of hazards, but we also have rankings in terms of probability, severity, and manageability. And one of the things I'd like to point out here is that, most of these risk assessments are similar, right? Like most of this is pretty common knowledge. So if I went into a risk assessment and coastal storm and respiratory virus pandemic were at the bottom of my list, I would know that however solid my method was, something was wrong, right? Coastal storms are a big deal. You saw all the hurricanes that have happened to New York City. Pandemics, we just had one. You know that although they may not be the most probable, they are incredibly severe disasters. And, practically every New York City risk assessment previously comes up with either coastal storm or pandemic as number 1 or 2. What was interesting about this risk assessment is that cyber attack, because of a changing threat environment, as we recognize, the features, as we see more and more cyber attack is something that's really, really concerning. But I can tell you, if we'd done the risk assessments the old way, cyber attack probably wouldn't have climbed to number 1 for a couple of years. And that's mostly because, our traditional experts are not used to thinking of cyber attack as a number 1. It's always coastal storm or pandemic. But what you can see here is that the probability of cyber attack is pretty high, right? It's number 2 on our probability list. Its severity is pretty bad. It's not the worst severity. You'll see that the worst severity is pandemic, which, I think we can all agree that's probably a fair assessment. But what happens is our manageability is 0, right? We have no idea what to do in a cyber attack, and we are not prepared for a cyber attack. And that's really what drove cyber attack to be number 1, that we don't know how to manage it. And so I think it's very interesting as you systematize these risk assessments, you're better able to elicit the knowledge of experts that they already have, without necessarily relying on, a recency effect or this sort of traditional dogma of coastal storm and pandemic being the worst disasters. So this way we've captured sort of the best of the sort of historical consistent experience, but we're also able to elicit new trends. And now I'm just going to go through 2 examples of how this was directly useful to us in preparedness, from the moment we started. So actually, if you go back, I told you we finished this in late October of 2018. In November, we planned cyber attack. Unfortunately, we planned cyber attack as a divisional goal for the next couple of years. Unfortunately, those next couple of years quickly went into 2020, when, of course, we experienced a real pandemic. But we did, if you look at New York City cyber, we went into 2020 with some preparedness for cyber attacks, which is more than a lot of other jurisdictions were able to do. So I'll just talk about 2 applications in terms of the usefulness of this model that you can get out of by using the AHP. And this table here shows our different manageability activities. Remember, I told you we have an inventory of activities, each of which has an owner in preparedness. They have a weight, which basically talks about their importance, their relative importance in all hazards to all disasters. And then, of course, we have how good we are at managing that activity in each of these different hazards. Now, just as a simple example, and I don't want to take up too much time, but as a simple example of, how tremendously useful the data generated by AHP can be, if you look at these activities, now I happen to know that M8 is countermeasures. So these are your vaccines. If there's an anthrax attack, this is the distribution of hazards, but really like point of dispensing of countermeasures, right? And if you look at, this is only applicable to certain hazards. Obviously, what is your point of dispensing for a cyber attack? But if you look at these, final weight numbers, or these final numbers, right? You'll see, for example, that let's say I am the bureau in charge of running countermeasures. So my job in preparedness, day in and day out, is to really prepare these countermeasures. I understand that my highest score here, right, is related to H5, which happens to be pandemic, right? And so I really want to focus my energies here. It's important for me to prepare for a pandemic, right? I have to, this talks about how good I am at it and how important it is. However, I'll notice that for water contamination, right? For water contamination, I have a very low score, and that's because we don't really think about water contamination in New York City. But as we've seen over the past 5 years, there are more and more threats to our water system. And so maybe what I need to do is I need to take a couple dollars and some time and invest it in creating a plan for countermeasures around water contamination. And then this is, this is something that for our emergency preparedness and response group that we were able to create that we found really useful, that was actually used to an extent. But what you have here is every single hazard, right? And what we did is we took the importance of the activity, which is the weight, right? And then we plotted it against a statistical distribution that we called a standardized effectiveness, which again says how good are we at doing this activity. And what happens here is that, when you're designing your exercises, training, and evaluation, you're going to choose a hazard, right? And so I'm going to choose H2, an emerging epidemic, not only because it's it's a very common hazard that we've been dealing with lately in the Anthropocene era, but also because this was actually a planned exercise for, unfortunately, March of 2020. As you may be aware, New York City shut down March 15th of 2020. And so our exercise, which was scheduled March 14th, didn't happen. But we had planned an exercise. And the way we planned this exercise was to say, what is important? What are the most important activities? So you go on your x-axis here and you say, which are the high importance quadrants? And then you can look at your standardized effectiveness. And you want to pick your activities so that your activities that you are good at, right, are practiced, right? You want to make sure that you run through these very important activities that we are well prepared for. But your exercise needs to focus on these activities where they're very, very important, but you don't have a solid, well-defined plan at them. You're not really good at them in response yet. And so this is where you want to invest your serious evaluation. This is where you need to have corrective actions. You need to have improvements. And by the next cycle, by the time you go into your next plan, you want to make it so that you can push these up. And in your next risk assessment, the things that are down here are starting to move up to very important, and we're very good at them. And again, hopefully that exercise will happen sometime in the near future. We unfortunately have not been able to reschedule that exercise because we keep having real disasters. And I know I went through a lot of that very quickly, but I wanted to leave some time for questions or for comments. But I'll just, very briefly go over the features, to conclude the features of this assessment using the AHP that are really novel to the field and add to the field. And one of them, which is, as I described, the most important, is that it really expands our traditional definition of expertise to include lived experience of disaster. And, this is something that we discuss in the paper that I didn't discuss as much in the presentation. But, there is a whole conversation and a whole field about what it means to have community participation or civic participation in government, right? And very often when we talk about having, engaging the community, engaging the healthcare system or other sectors, we talk about, we have a liaison who maybe goes and has a conversation and fully represents the whole diversity of the community. So this is the first model of disaster risk assessment in the United States where we actually have direct participation by all of our sector-wide participants. It, of course, accommodates a nearly unlimited number of participants who are, again, sure, making decisions about disaster preparedness, but are also making decisions about, how they're protected if a disaster hits, where their tax money is going, and, what their values are and how their values fit into an overall statement of values of New York City. It is, of course, interoperable with our health department operational frameworks, which means that we were able to use the findings immediately and use them in new ways that we had never used risk assessments before. The transparency and detail of the AHP, allows really rich communication with everyone, with leadership, with internal stakeholders, with external stakeholders, but can actually set the basis and set the groundwork for, these are 5-year assessments, for 5 years of rich ongoing conversation and participation, or conversation and partnership with community members, the healthcare sector, and other sectors. Of course, our new novel nuanced method to estimate disaster probability, we're still seeing what the impacts of that will be. But, I can just tell you, within the health department, very often our discussions around disaster probability were really made by non-experts, because there was so much disagreement between experts on which method to use. And this way we were allowed to have a consensus single metric for disaster probability. And finally, we completed this entire project with 2 staff. We have an online R server, but R is a free software, and SurveyMonkey, which is a proprietary software, but has these built-in accessibility features, and was already an agency purchase. And I think that's all I have, but I'm happy to take questions.
So that was really great, Didi. Thank you. I just had a quick question. We've done some work in enterprise risk management, and they have sort of these 3 considerations that they usually talk about: likelihood, impact, and velocity. And I think you guys have close definitions around probability, severity, and manageability. And I was just wondering, the concept of velocity and how quickly a disaster comes on, how does that get sort of captured? I guess that's part of manageability, or manageability is a broader concept than just velocity, right?
Yeah, and I think that, disaster risk assessments often don't have that velocity component in them. There's another model that disaster risk assessments usually use, which is like threat and vulnerability based. Which is, very similar. It's just a slightly different way of looking at it. The way that we really incorporated velocity, I think, is through our probability metric, where we have this idea of the changing threat landscape, right? And so that's actually incorporated into your assessment of probability. And this changing threat landscape idea is 40% of the full probability measure.
Oh,
right?
Wow, yeah.
Yeah, and so, that's something that, again, these like really rare, right, high impact, low probability events are so difficult, like conceptually, for humans to understand and prepared for. But this is our whole field, And so, like I said, hurricanes, we can talk about the number of hurricanes. We can talk about, how have they been increasing lately? We can talk about models of hurricanes, but I can just tell you, as someone who is a hurricane responder, that because of climate change, we're just going to be seeing more. So even if I've only seen 2 or 3 hurricanes in the last 5 years or 10 years, we're going to be seeing more in the future.
Thank you.
No problem.
Questions?
Well, I don't exactly have a question. I just wanted to say, what a remarkable talk. There's so many things that we could talk for probably hours on each one of them. You opened so many possibilities. For instance, I didn't know that people doing risk, repair, were working at it all the time. That's a surprise to me. Of course, they have to be, but I never thought about it. I want to compliment you. You did an ANP thing with your very first slide. It was, I think, not that one, the next one, maybe.
The decomposition one here?
No, right there. See, you're doing ANP. You're evaluating your events versus the probability, but then for each event you're going back and saying, is it more probable or more severe or more manageable? That's an ANP model, I think, anyway.
Yeah, no, and ANP probably fits really well with disasters. I mean, this one was the reason we framed it as AHP is honestly because it was the first time we were doing it, and we wanted to, is for the simplicity of it. But yeah, I mean, also like nothing in disaster management is independent. There's no such thing as one criteria, one sub-criterion that is independent from any of the others. But I think that we managed, part of it was also the community engagement. Like we really needed to frame the decisions in a way that we could get the community to understand them, and I will say that this is where I didn't go into, the impact of pairwise comparisons, but the pairwise comparisons are really what allowed us to have, a PhD in pandemic flu probability, making decisions together with, about the severity of a pandemic flu, together with, a community organizer who had developed, a small community preparedness council within their neighborhood.
Your collection of data is just fantastic, amazing. How did you do that with two people? I mean, congratulations.
Well, luckily the SurveyMonkey tool has a lot of there's a lot of ways that you can systematize it. Like we had created these definitions and actually I could actually like code the creation of most of the surveys, through like random alterations of the different alternatives, et cetera. And but yeah, I think I made a total of 86 surveys for this process.
And how did you get people to respond to them? Speaking of response.
Yeah, well, I think that people are hungry to participate in government. Like in New York City, we pay a lot for our government, right? I pay a lot of, I pay the money in taxes. Where people are afraid of disasters, and all of our experts are people who think about disasters anyway. We didn't take just someone off the street. We took somebody who spends time thinking about disasters. And so there was a real eagerness and a real hunger to share expertise in a meaningful way and in a way that would get translated into resource allocation. We did, and this is something that in repeating the process, I would like to do more systematic community engagement and, do a little better tracking of who responded and how they identify and what sector they put themselves in. Maybe even, sort of try to disaggregate results by different sectors to see if they're different. But, we used mostly a snowball method, right? Like we talked to partners that we already had, and we did these, sort of hour-long or hour-and-a-half-long presentations, sort of teaching them about AHP. We didn't do a whole lot of like one-on-one teaching, but because the pairwise comparisons are so intuitive, I think that, we found that actually our public health and academic stakeholders had a really, really hard time with the pairwise comparisons because they're used to making these very complex, rankings on their own, whereas the community members loved them.
Well, like I said, I could talk to you for hours, but let other people ask their questions. Thank you.
Yeah.
Sure.
Can I ask a question?
Go ahead, please.
First of all, thank you very much. Thank you very much for giving us time so that we can ask some questions. And I have one thing I observed. Maybe I should direct this question to Luis Vargas, because I have seen that you said you use absolute scale, whereas there are quite a few of us, we think that we are using ratio scale. So could you give some explanation to us, Luis?
You want me to give you the explanation? You let me do it.
Yeah.
Well, do you remember in one of the HP conferences we had a long time ago?
Yes.
Somebody came and said, the fact that you use a 1 to 9 scale, that scale is not a ratio scale, because if you multiply those judgments by a number, you try to use that, you discover that you don't get a constant, you don't have any variance in the result. So the scale is an absolute scale, and with Tom, I remember talking to Tom, and he always said it was an absolute scale, and I agree with him. So, but people keep saying ratio because you're estimating a ratio, but that doesn't mean that this has to be a ratio scale. The result is a ratio scale because it's invariant to multiplicative transformation, right? Because you add it to unitary. So that's the beauty of the whole thing. So it's an absolute. You can call it an absolute ratio scale if you want, but it's an absolute scale. because 5 is 5 times more. Unlike, for example, the Likert scale, which is not really a scale because 5 is not 5 times more, right? So, but people use numbers any way they want. They say, well, the number is a number, just play around with it. Well, all the examples and jokes that Tom had about this driver running around, and I've seen it actually in Arizona, where they have this, it says population, altitude, and they add them up. So you're adding numbers, but it doesn't make any sense, right? So,
and yeah, I'll say that's exactly what a lot of these assessments do. Even the assessments that I think that leverage risk perception, one thing that if you take some of these other assessments, if you, the WHO used a modified AHP method for their emerging infectious disease blueprint, and they did not do pairwise comparisons, right? They didn't use this absolute ratio scale. And the thing is, they had a series of 24 experts who were used to thinking about, who are all used to thinking about emerging infectious disease risk in exactly the same way. But if I have a 1 to 10 scale, I can tell you that my community members are not going to be thinking about them the same way as my PhDs, right? Or somebody in the healthcare system is not going to be thinking about them in the same way that a public health person who's used to thinking on a systems level is thinking. And so we had to, the absolute ratio scale did complicate things. It increased our number of comparisons by quite a bit, right? But, I think that we were able to involve a larger number of participants directly, right? So it was okay that we had a lot more comparisons. And I think that, doing the same old, ranking type comparison is not very interesting for a lot of people. But the pairwise comparisons really, people were excited to do them.
So
can I get, yeah. Okay.
I'm sorry, tell us how many people actually participated in overall in the exercise. What, 700 people or something like that?
No, 1834.
1834. Wow.
Yeah.
I thought it was only about 700, but you really, I never know it was over 1,000. Wow.
Yeah. So we had, and this is, without a systematic community engagement, because I think our community engagement staff, while this project was still abstract, it was a little bit hard to get them, they didn't have the whole picture until we actually had the assessment in front of them. But I think, again, repeating this with a more systematic community engagement process would be, I think we would get an even greater community and healthcare system participation. As at least in the paper, we actually talk about how, New York City has a pretty well-developed, community network and community engagement around disasters. But we actually, in the paper, we created a model of civic engagement with government where you can actually do sort of progressive or tiered engagement, no matter where you're starting with your local engagement. So if you only have, one employee who goes out and talks to the community, you can start with that, but you could use this process to build progressive models of engagement for your whole organization by using the AHP for disaster risk assessment.
One more small comment. I really appreciated that you considered accessibility. So you include it when you are doing this survey, you consider accessibility. And one just small question, what do you think? We are just thinking that a pandemic is over, but we think that its impact will really continue. What is your view about it?
Well, I don't think the pandemic is over. So
okay. So
public health managers don't think the pandemic is over. But yeah, I think that, these disasters cause, in some ways they're sort of windows of change, right? And things that we never thought that we could do become the norm. And I think that this, we did face some pushback on having this as an online sort of platform and the online assessment and not sitting in a room with a bunch of people and having them able to communicate with each other. But I think that now that the pandemic has happened, there's a lot more precedence for this type of model where you're doing things remotely that previously you used to do sitting in a room. And I mean, we could have done this in, if we had had more resources than 2 people, you know, we could have done actual site visits where we went to libraries, or we went to other community centers, or we went to healthcare facilities, and, you know, just had them use the tool with us. Similarly, you know, we shared materials, but we also had, you know, we had a very sort of primitive platform for people to communicate with each other, but doing it again, we would have like a larger platform where individuals could actually communicate with each other about their decisions, you know, even if it were through a chat, or if we set up several facilitated discussions additionally.
Thank you. Thank you.
No problem.
Any more questions? Well, I guess this is concludes the plenary session. Didi, thank you very much. Very interesting.
Thank you so much.
Thank you for participating.
And if anybody knows a jurisdiction that wants to use it, you know, just give me a call.
Thank you.
Thanks, everyone.
Thank you
Bye.
very much.
you.
Thanks a lot.
Bye.
Thank you.